Okay, second video. This is the second video I'm making. I accidentally deleted the first one. Yeah. So, hey guys, this is Bree with Bree on a Budget. Just checking in with you guys to let you know about my 4.5 week post-op update. So, it has been truly, truly a ride. I was in the ER, as you could see from the title. I have a seroma that is slowly but surely trying to heal. I don't really know what's going on. Very frustrated, very tired of the situation. Um, this originally started Memorial Day weekend. I had seen that it was swelling up above my pubic area the entire time since I had the surgery. And it was kind of sore and feeling weird, but I didn't think anything of it because, they tell you that you're going to swell and all that. So, but right up under there was really, really swollen. So then there was this little small hole by my incision that was draining fluid. So when I went to the doctor the first time, they told me that it was old blood coming out. So I'm like, okay. So they put a little pad on, and that was that. So I got a lymphatic massage on Friday, the Friday before Memorial Day weekend, and got the lymphatic massage on Friday, and then I turned around and had another lymphatic massage on Saturday. So I drove around for a little bit because I was bored after my lymphatic massage, came back home and started having flu-like symptoms. So I kept taking my temperature, kept saying that it was normal, but I was feeling like I had a fever and I had chills. I mean, it was terrible. So I make my own herbal teas and tonics for immunity and cold and flu and that kind of thing. So my first thought was to take a cold and flu tea. But I was like, no, I don't feel like standing there making tea, so I'm just going to have some of my immunity tonic. So I got some Pedialyte and I mixed about a shot of it in the Pedialyte. Now, mind you, when I have people to take it for immunity, they only take it like by 4 droppers. So to take 4 ounces means you're actually sick. So that's what I did. So I take the 4 ounces, I'm laying in bed, and all of a sudden, um, the the seroma, because that's what it was, the swelling there, and the little hole that where it was draining, it starts draining profusely. So I'm like, okay, what's going on here? So it's draining, it's draining, it's draining. So by this point, I've gone through a whole box of super pads in like a couple of hours. So I'm like, I don't know if this is normal, but we're going to go with it. So the next day comes around. By this point, I've gone through the second box of pads, or more than halfway through it. So I had to pick my son up from the airport. So I was already kind of dreading that because I didn't want to have to go out like that. But what am I going to do? So I get my stuff on, I get ready, and I take him. I go get him from the airport. Well, his flight was delayed getting here. So I'm like, okay, well, I'll just go to CVS and get some more pads because obviously I'm going to need it because this thing is still draining. So I get to CVS, I get the pads, I get home, I'm picking him up from the airport, get home, I go in the bathroom to put on the pads, and I pull my pants down, and I mean, it's pouring out onto the floor. So I'm like, what in the world? So at this point, my son's like, well, Mom, maybe you need to go to the ER, like maybe you need to go to the hospital and see what's wrong, whatever. So I'm like, oh my gosh, I just don't want to deal with this. I don't want to go to the hospital. The hospitals where I live are always super crowded or whatever. So I called them and I'm like, hey, what's your wait time looking like in the ER? And they're like, oh, it's not bad today, like maybe 2 hours. So I'm like, okay, I can deal with that. So I get my clothes on, I double pad myself, and I go to the ER. We get there, I get to the back, see the doctor. He looks at it. He's not concerned at all. He's like, well, it does look like old blood. It doesn't look like anything that's coming, fresh out of an artery or a vein, but, I know that doesn't make you feel any better. So, we'll do a CAT scan just to make sure that it's not coming from a vein or an artery, and then go from there. In the meantime, what's your surgeon's name? So I can go ahead and give him a call. And he's like, otherwise you're everywhere else around the wound, or the incision looks really good. It's just that one little area. So I'm like, okay. So he calls the surgeon. They do the CAT scan. He comes back, and sure enough, it's not coming from a vein or an artery. It's just a seroma that is releasing the fluid. So he's like, this is probably a good thing. He says, I don't want to stitch it up because, when these things happen, that fluid needs to come out. And you just need to follow up with your plastic surgeon. So I'm like, okay. So I had just so happened I had an appointment the next day with my plastic surgeon anyway. So I get in there. He has to drain fluid from my arm again. I don't know if I mentioned that in my last video, that I had to have fluid drained from my arm because I had a seroma in my arm. And so they drained the fluid from my arm. So now this thing is draining fluid, and he's like, okay, well, this is great. I'm actually glad this happened. I'm sorry that it came out so fast that it scared you, but it actually is a good thing that it came out, and we want it to continue to drain, because if it's not draining, then we have to go in and aspirate it. So I'm like, okay. So I'm thinking, at this point, when I got up to go at the pouring, the profuse pouring of whatever it was had kind of subsided. So it was just kind of coming out, not pouring out. So I'm hoping at this point that I'm good to go or whatever. But guys, this thing is still draining. That was Memorial Day weekend. It is now June 12th, and it is still draining. So, at this point, I have my cycle. I've been wearing my binder. The other day when I went to get my hair done, I did put on my faja, and I had on this cute little dress, and I felt so cute and so confident or whatever. But I had to put on underwear under the faja so that I could hold up the pad on the area so that it wouldn't bleed onto my faja, because I'm still draining. So my doctor set my appointment for 3 weeks out. He's like, oh, you've seen the worst of it, blah blah blah. So now I got my cycle. I put on my faja today because I was supposed to have a signing because I'm a mobile notary. And now my faja, I guess because I'm so swollen from my period being on, that it's now cut another hole into my incision. So yeah, so I put this is it Manuka honey adhesive strips. I put that on the one that just happened today. Of course, I haven't put anything on the other one because my doctor calls it the lifeline, and that he wants that one to remain open so that it can continue to drain, because they need all that fluid to keep coming. So I also bought this stuff, as I heard from someone that it does help with wound healing. It's called Juven. I noticed that when I do take that, I do feel really good. I'm a vertical sleeve surgery person, so it's hard for me to get in a lot of stuff in one day. You have to wait 30 minutes after you eat or to drink, so sometimes that can be hard. Getting in that, and then I also have a vitamin C drink that my doctor recommended that I take as well. That sort of helps with immunity and wound healing or whatever. So I had tried to say that I would alternate those, but no, I need to take this Juven probably every day until these things are healed up. I have a friend in Atlanta that had a BBL recently, And she said that there's a lady there that is really good about helping people get themselves together after plastic surgery with wound healing. So I'm not sure if I'm going to make a trip there and pay for a session with her just to find out some extra things that I can possibly do at home just to make this better, because I'm miserable, guys. I mean, like, I I feel so limited in what I can do because I'm draining. I'm just constantly draining. And so I don't know. I think I'm going to ask for some more time off work now that I have another hole in my incision. My arm still feel like they're collecting fluid. Like, this arm looks pretty good from my lift. Of course, I have on compression. Let me try to see if I can set this here so you guys can kind of see the scars from that. And I did put on the silicone a little bit yesterday. But yeah, so that's how that looks. And my arm, like when it's not in the compression, it's like still wiggly a little bit. But I don't know if that's just swelling or what. But it seems like when the compression is off, that it's not really that small. I feel like they could have took, excuse me, I feel like they could have took some more off of my arms, especially this other one. This is the one that they drained fluid from because I had a seroma on this one. And this one actually looks like it's still, like I can still have like a bat wing with this one. And you guys can probably see how much bigger that one is than the other one. But the scar looks really good. Can see that? I don't know if you guys can see that, but yeah, there, that's better. As you can see, that's a line from my thing, but and you can just see how swollen it is that I have that indentation there. And then that line is from, you see the, I can't even talk. You see the line of the scar. It does look really good. It is healing well, but as I said, it looks like to me, it's still big. And they could have took some more off, but I'm going to just hope that it comes down with the swelling. So that's that. So that's the first time you guys have seen my arms, because I haven't been showing them because they were so gross. Yeah, so I don't know, guys. It's been a ride. It really has. I'm trying to stay positive. My doctor, he's saying, you're so kind and you've been so patient with this whole process, even though you had quite a few hiccups. And, I really appreciate you having confidence in me and this and that. And he is a good doctor. I do sometimes feel cattle-like there, like they're just kind of pushing you in and moving you out. But what are you going to do? This is normal life for them every day. It's not your normal life, but they see these kind of things all the time, so it's not a big deal to them. So I guess I'll just continue to take the Juven, continue to take my supplements, and I am going to ask for some more time off work because I need more time to heal. It's just what it is. But you guys have a great day. I wish you guys much better success and a lot less complications than I've had. Overall, I'm still happy with my decision. I do look great. I will have some pictures at the end, and then when I do my 6 weeks post-op, hopefully things will be better, and I will have some more pictures in that video. But I do have some before and after my VSG, as well as before and after my plastic surgery as well. So I'll post all those so you guys can kind of compare and see like the difference in my arms or whatever. Arms are still pretty swollen. I'm actually thinking about taking some of my water pills. I take water pills for blood pressure. I don't like that they strip every ounce of water off of you when you do take them. But at this point, I'm just kind of desperate to get this swelling and this stuff gone. So, and I'm supposed to be taking them anyways. I just haven't been because of the surgery. And I've lost a lot of weight. Guys, I, during my surgery, they removed 7 pounds of hanging skin from my body. So I had no idea. Some of my friends that had lipo were like, well, how many liters did they take off you? Blah, blah, blah. So when I went for my last appointment, I asked my doctor, I was like, hey, well, how many liters of, fat did you guys take off with the liposuction and the excess weight? And he's like, oh, we took off 7 pounds of hanging skin. And I was just like, I mean, I was big, but I just had no idea that was like a whole baby. So, yeah, it's crazy. But I will talk to you guys soon, and I guess I will post that 6-week post op update in just a bit. So, you guys have a good one. Bye.